5% of Coloradans have received the COVID vaccine so far, but we still have a long way to go before things can return to normal. So joining me now is CBS 4 medical editor Dr. Dave Nida. And a new survey found 6 in 10 Americans don't even know where to get a vaccine. So, Dr. Dave, what's your message to Coloradans who want to know what to do to get vaccinated?
Well, I think the main message is, if you're feeling a little bit frustrated right now, you're certainly not alone. I think that at this point in time, there really is a logjam in terms of trying to get people vaccinated. We have expanded the eligibility for people who are allowed, so to speak, to be vaccinated, but yet the number of vaccinations that we have available are very limited. So we're trying to funnel through a large number of people through a very small door, so to speak. I think the two things to keep in mind here is, number one, you need to be patient. Number two, you need to be lucky, actually, in order to be able to get vaccinated at this point in time because of where we are. I recently took a look at trying to figure out how I would get a vaccine if I wasn't in healthcare. I went to the state health site and it was okay. I did find, though, that the individual individual county health department sites were a little bit more effective in terms of pointing me in the right direction. I found that I was able to get onto places such as major hospital systems and be able to sign up for getting in line to be vaccinated in the major health hospital systems, as well as Kaiser. I also found that I was able to sign up through a community healthcare site. Additionally, I took a look at the availability of vaccine through things like Safeway as well as King Soopers. That was a little bit more challenging, but it was possible. I think that your best route to go in a situation like this is to sign up through your county health department, take a look at which hospital system or community healthcare system you can join in terms of being in their lineup, so to speak, to become eligible to get a vaccine when it is available for your particular group. And I believe that that will help quite a bit. I think that at this point in time, if you are trying to help out a older parent, it is possible as well to sign them up and become a proxy, so to speak, so that you can assist them through the process as they try to figure out where they can be vaccinated. You can certainly assist with that process. I think the big message here is that right now it is confusing, but I think that in light of where we are right now, we do have some rather darker days here as we make our way through a maze of confusion. But I think that if we can hold on here for approximately another 6 weeks, I think there will be more vaccines available. I think that we will wind up being able to be vaccinated. I think we were expecting that once everything opened up a little bit more, we were going to be able to just easily figure out how to get these things done. But that certainly has not been the case, but it will get better. And keep in mind this as well. Colorado, despite the fact that you may feel frustrated with the system, Colorado ranks in the top 10 of states in terms of their efficiency in getting people vaccinated. So we're really actually doing a good job given the few tools that we have been allowed to be have available.
That's interesting, and a lot of great information for people who are confused. We know we've heard it from a lot of different people. So Pfizer's COVID-19 vaccine trial for kids is fully enrolled. Why will it be crucial to get a vaccine for children?
When we think about the numbers of COVID cases in the United States, 1 in 8 children make up the cases throughout the country. So obviously that's a big thing. Now, certainly children, particularly those under the age of 12, tend to get less severe illness if they do wind up becoming infected, or no illness at all. There is a concern about contagiousness. And so I think that vaccination is going to be important for all age groups, especially older children. Right now, the Pfizer vaccination system is working to test their vaccines on children beginning at age 12 and older. Those trials are already underway. Moderna is also beginning testing, but their vaccine trial group has not been filled up yet. It's very interesting because when you look at AstraZeneca, which is another vaccine that is not currently available for use in the United States, they are beginning trials in children as young as 5. Bottom line here is I think that we're not going to see results quickly for these vaccine trials. It probably will be at the summer at the earliest. And I think there's going to be a little bit more caution in terms of emergency use authorization for these vaccines because they do involve children rather than adults. We hope that we're going to be able to do some vaccination before the 2021 school year begins. But I think that right now it's too early to say that we're definitely going to be able to do that.
Interesting. And so many businesses do temperature checks as part of their COVID protocols. So why are some experts saying we shouldn't be doing that anymore?
It's funny. It's that temperature checks are not exactly the most reliable indicator of illness, number one, and certainly not particular for COVID-19. If you take a look at the people who have COVID-19, only about half do develop a fever, if they in fact do develop symptoms. And the amount of time that they do actually get a fever is actually a very short window of time. So you really don't catch a lot of cases just by pure temperature screening. And if they are symptomatic, they're going to be ill and they should not be in the area that they are going anyway. Then you also have to take into account asymptomatic people who are not actively sick with the virus, even though they are infected. They are going to obviously have a normal temperature, so you are going to miss that group. There are a couple of things that people are looking at in terms of trying to develop some sort of mass screening tool for places. They include things like actually a sniff test, a smell test, because many people with COVID, even without symptoms, do lose some sense of smell, even though it is subtle. So there is some research that actually has come out of University of Colorado in Boulder that has taken a look at a simple smell test. The problem with using something like that on a wide-scale basis is that many older people, as well as people, let's say, with chronic allergies, they naturally lose some sense of smell, so the test would not be extremely accurate for them. I think one of the better answers is going to be the development of rapid saliva testing, where you simply can do a very quick spit test in order to check people before they enter a building. I think overall, too, you really do need to take a look at the fact that a lot of this is common sense. If you are ill in any way, shape, or form, you really do need to stay out of public places, whether you're going to work, whether you're going to dine somewhere, whether you're going to a store, you're going to school, whatever. There does need to be a sense of personal responsibility with this. No matter what your illness is, whether it's COVID-19 or some other infectious disease, you simply should not be present in a location like.
Great advice and great information as always. So thank you so much for joining us. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And if you'd like to see all of our Q&A with Dr. Dave segments, you can head over to cbsdenver.com. We'll be right back.